Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining us on the show today. This is the show dedicated to teaching you natural solutions to today's worst health problems. And my purpose is to try to help as many people as possible live a healthier life using natural health care. And that is such an important thing because, guys, life is too short for you to be sick and suffer and not feel your best so that you can do the things that you enjoy doing in life. You know, each one of us within the sound of my voice has a limited number of days left on the planet. And for you to be spending those days less than your best is a human tragedy, especially when there are natural solutions for you to solve your health problems. It's just no one has told you about them yet. And that's why I'm driven every single week to come here and teach you things you can do to turn your health around, get your energy back, and rid your body of diseases, and start being at your peak health for each and every one of those days. I'm here with my co-host, Brandon Como. Brandon, how's it going?
Oh, I'm doing well, Doc.
Well, today I wanted to discuss something that I get asked every single day in my private practice. And, you know, patients ask me this all the time. They'll say, Doc, what are the supplements that me and my family should be taking? Like, if you could pick 2 or 3 things, what would it be? And honestly, I think there's probably too much emphasis placed on that. If you have something wrong, if you have a health problem or you have a disease or a health condition, taking supplements by itself is probably not going to be enough to really change your health. And a lot of times people feel like that's all they have to do. It takes way more than just that. But if I could pick 2 or 3 or even maybe 4 things that everyone should be taking, what would it be? And since I get asked that so often, I wanted to answer that question today. If I could give everybody in America 3 or 4 things, what would I have them take on a daily basis? So I wanted to answer that question today. If I could give everybody in America 3 or 4 things, what would it be? Now, the first one on the list is vitamin D3. And you might say, well, Doc, that's kind of a boring one to lead off the pack with. But however boring it may be, it's also very much one of the most important things that everyone should be taking. And listen, I don't want you guys to fall in this trap of saying things like, oh, Doc, I don't need to take vitamin D. I drink lots of milk, or, you know, I go out in the sun. I don't need to take vitamin D. Until you have your levels checked, don't assume that you either eat a certain thing or drink a certain thing or do a certain thing and your levels should be fine. That may not actually be the truth, because just because you do those things does not necessarily mean that your body is able to produce or have adequate amounts of what you need. And the other thing is, if your doctor has told you that your levels are adequate of vitamin D, you need to get the number. You need to say, what was that D number? What was the actual figure? Because many times the levels that traditional medicine calls normal and the level that your body actually needs to be at its peak performance are not the same thing. For example, on vitamin D, traditional healthcare says that anything over 30-something, usually they use 34, anything over 34 and your body is fine, like that's good enough. But if you want your body to be at peak function, I like 60 better. And if you have a disease, I like 80 even better than that. Vitamin D does over 900 processes in your body. It's what we call a global effector. It is a baseline of health. Now, you can take too much vitamin D, so you don't want to go over, 80 to 100. That would be getting too much. But unfortunately, I regularly see patients in the single digits. I'm talking a vitamin D level of 7 or 8 or, even 14 or 15. That is chronically low. That is dangerously low. According to PubMed research, which, if you don't know, PubMed is the actual written research done by research experts. PubMed is where us doctors go to figure out what the latest research is saying. And according to an article in PubMed all the way back in 2010, and I think it's even gotten worse now, but in one study, they stated that there's mounting evidence that suggests that vitamin D deficiency could be linked to several chronic diseases, and Americans have chronically low vitamin D levels. These diseases included things like cardiovascular diseases and cancers, which just happen to be our top two killers in America. Now, get this. What they called low vitamin D levels were below 20. They found that 41% of the people that they tested were below 20. 20 is seriously low. That's chronically low. In African Americans, the number was 82%. 82% of African Americans had a vitamin D level below 20. Now, given that vitamin D deficiency is linked to some of the leading causes of death in the United States, it's very important that this get looked at. And you've got to get the number. So if you've been tested and your doctor looked at your blood work and said, oh, everything's fine. Hey, what was my vitamin D level? What was the actual number? Now, as a little side note here, if you have been tested and your vitamin D was low and your doctor prescribed you vitamin D, that's still may not be good enough either, and here's why. Oh, and by the way, guys, we're off of the PubMed article. I just wanted to be real clear where the research ended and where me talking took back over. I didn't want you to get confused about what was research and what was my opinion. But the reason I don't like the doctor-prescribed vitamin D is because for some reason, they have a tendency to give patients 50,000 international units of vitamin D once a week. So if your doctor has prescribed you vitamin D and you take it once a week, it's more than likely 50,000 units once a week. Guys, I have rarely seen that bring a patient's vitamin D level up significantly. I've rarely seen that work. And I test patients all the time that have been doing that for a long time, and they still have really low vitamin D levels. And I'm not really sure why they do that anyway. Why would you want to give a patient 50,000 units once a week and think that they're probably going to absorb all of that at one time? I don't know why they do that. I don't know if it's because to be considered not over the counter so they can prescribe it from a pharmacy and make it sellable as a pharmaceutical. I don't know. I don't know why they do the 50,000, but I don't like that. I don't like the 50,000 once a week thing personally. To me, it makes no sense. Giving somebody 50,000 units once a week, I don't think that really helps anybody except, of course, the pharmacies and drug companies. I don't see that helps patients. It's so much better to give you every day an amount of vitamin D. I think that you have a lot higher chance of absorbing that. And so, in my opinion, I've seen little success with patients that do the 50,000 once a week. Now, according to another article that I saw not too long ago, 50% of American kids ages 1 to 5 years old and 70% of children 6 to 11 years old had insufficient D levels in their body. So even our kids are vitamin D deficient. Guys, that's bone development. That's brain development. So many things in their body that can be affected by not getting the proper amount of vitamin D. Now, vitamin D is not your typical vitamin. It actually behaves much like a hormone in your body. It's critical to your immune system. It helps bind the gut lining closer together, preventing leaky gut syndrome, which is something we've talked about a lot here on this show. It has anti-cancer properties. Now, according to Dr. Mercola, who I talk a lot about on the show, he feels like the best way to get your vitamin D is through sun exposure. He's a strong advocate of sun exposure as the best source of vitamin D. And he stated in one of his recent articles that your skin is an excellent indicator for this. Like when you go out in the sun and your skin starts to turn pink, that means that you've had enough sun exposure to create D, and then you can go in once you get that pink color on your skin. Now, I've also, though, seen other research that says in order for sun to create vitamin D, there has to be this oil created on your skin. You know, when you go out in the sun and you come in the house, you have kind of this oil on your skin from being in the sun. I've seen articles that say that that takes 24 hours for that oil to create vitamin D. Well, what do we do when we go inside? We take a shower and wash that oil off. So I'm not 100% sold on the sun exposure creating D. I don't disagree with Dr. McCullough very often. And, you know, listen, he's brilliant with this kind of stuff. I need to look into that a little bit closer. But what I suggest doing is doing both. I recommend getting your 10 or 15 minutes of sun every day if you can, having your vitamin D evaluated, and then supplementing until your dose is where you need it. Especially if you have darker skin, that you don't get the penetration of sunlight if you have a darker color skin. So you absolutely need to have your levels checked and supplement until your levels are at least 50. I like 60 better. And if you have a disease like an autoimmune disease or you have cancer, I think it needs to be closer to 80. But in order for your body to operate at its maximum efficiency, having a high level of vitamin D is critical. However you get it, that doesn't really matter. It just needs to be there. Vitamin D also protects you from peripheral artery disease. It helps prevent bone fractures, and it helps improve almost all conditions of the skin. Now, the other thing about D is it controls phosphate and calcium levels in your body. Calcium and phosphate play essential roles in your nerves, bones, and muscles, so it's important for structural health as well. You know, so many patients come in with osteoporosis or osteopenia, which is thinning of the bones, and they'll say, well, my doctor has me on calcium, and their vitamin D levels are terrible. It doesn't work if your vitamin D levels are off. If your D is low, then your body is unable to control the calcium and phosphate levels, so you're not going to get that strengthening of the bones like what you're after if you just take calcium. That's why we have patients that have been taking calcium for a long time and it hasn't changed their bone strength or their bone density at all. Peripheral artery disease occurs when the legs don't get enough blood. So these patients will have pain in their legs during walking or other activities, and vitamin D can reduce the chance of that. And you know, I mentioned cancer earlier. Study after study has shown that a high intake of vitamin D can slow the progression of several types of cancer. It can even help prevent cancer of the prostate, lungs, skin, and lymphatics. And so, yes, the first thing that I would give every American is some vitamin D. How much? Well, it depends on every person's situation. You know, everybody's different. But vitamin D is one of those top things that everybody should make sure their levels are peaked. And, you know, since you can get too much of this, I like to do testing. You should get your 5 or 10 minutes of sun every chance that you get. And the best place to get sun exposure in your body is the large areas of your back. That's the most effective place for the sun to hit and develop vitamin D. It's not enough just for your arms and the back of your neck to get it, like if you work in the sun. You really want to have your shirt off and get that 10 minutes of sun on your back every chance that you can. But like I said, you should absolutely have your levels checked because you don't want to get too much and you also don't want to have enough. You really want to have that 50 to 70, even up to 80 if you have a chronic disease. Now, I have a supplement that I use in my office. Instead of this silly 50,000 a week thing, I have a supplement that is 1,000 units per drop. One little drop is 1,000 units, and it's liquid, so it doesn't have to pass through the destroyed digestive systems of so many patients. And that's the other problem with oral vitamin D. People's digestive systems are so destroyed that they don't absorb what they take. It's not what you take, it's what goes inside your body that matters. So if they're absorbing maybe 10% of what they're actually taking and they're only taking, 400 IUs a day, that's not enough. That's not even close to enough. And sometimes patients will say, well, I have vitamin D in my multivitamin, so I don't need to take that. That isn't near enough either. Like I said, if there's 400 IUs in there and you're only absorbing, 25% of that, that isn't near enough to change your vitamin D levels significantly. So with this liquid, it doesn't have to pass through your destroyed digestive system. And it's very easy since it's 1,000 units a drop. I can say take, 10 drops or 15 drops or 5 drops or whatever it needs to be. And it's very easy for patients to measure that. Now, I tell this to patients all the time. It's a drop, not a dropper full. I've occasionally had a patient go through a bottle of D very quickly and they said, you said it was 1,000 units per dropper full. No, it's a drop. So one single drop is 1,000 units, and it's very easy to be able to say take 5 drops or 10 drops of it. And that will get your body into its peak state of healing, and that is very important. We test every one of our functional medicine patients that come into our office to see what their vitamin D levels are and what we need to do to get their vitamin D back to a healthy state where their systems, their cells, and their tissues can be at that peak state of healing. And that is so important with chronic conditions. And when we get back from this next break, I'm going to tell you the second most important thing that every single person in America should be taking. But before we cut to this break, I wanted to let you know if any of you out there are suffering with some sort of a health problem and you don't know what to do about it, or you're frustrated with what's been taking place with your care for whatever your health condition is, I would love to have the opportunity to sit down with you and see if my methods might be able to help you. All you have to do is call my office at 837-7174 and leave your name and number on the machine, and I will personally call you back when I get back into the office next week, and we can have a simple phone conversation to see if I think that my methods might be able to help you. It's 837-7174 because, like I said, life is too short. You don't want to spend your days not being at your best, especially when natural solutions exist. So it's 837-7174. Stay tuned. We'll be right back with the second most important thing you should be taking. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. We are discussing the top 3 or 4 supplements that you should consider taking to improve and to maintain your health. And we just covered vitamin D, and that's an important one. Vitamin D is one of those supplements that you have to have your level tested to make sure you're not too little and not too much, because you can get too much vitamin D. So don't just start taking a bunch of this, on your own. You really want to know. You want to shoot for that, certainly over 50, 60 to 70 is actually better. And if you have a disease, 80 is even maybe more ideal than that. Now, this next one is another critical thing that everyone should be taking. And with this one, you can't take too much. Just take it. It doesn't matter. I can confidently say that everyone in America should be taking this, period. Children, babies, everyone should be taking this, and that is omega-3 fatty acids. You may know this as fish oils. Omega-3 fatty acids are incredibly important. They have many powerful health benefits for your brain and for your body. In fact, few nutrients have been studied as thoroughly as omega-3 fatty acids. And what makes this so important for our bodies and for our cells is this is what our cell walls are made out of. Omega-3 fatty acids are what our cell walls, our brain cells, our nerve cells are all made out of. Our bodies are designed to consume fish oil or fish. Back in the biblical days, anytime food comes up, it's fish. Our bodies were developed to run off of fish, and we get almost none of that in the traditional American diet. All of this prepackaged processed food, high volume feedlot pork and beef and chicken has almost no healthy omega-3 fatty acids in it. And if I look at many times I'll look at a patient's food list, I have them write down everything they eat for a week. There's almost zero fatty acids, omega-3 fatty acids in their diet at all. And that has a dramatically damaging effect on their health and on their cells and on their body. Now, what makes omega-3s so absolutely powerful is they're very anti-inflammatory. And we talk a lot about that on the show. Almost every doctor you talk to will tell you that inflammation is the precursor for chronic disease. Well, yes, it is. Inflammation contributes to almost every chronic Western illness, including heart disease and cancer. But what's causing that inflammation? And that's where we really have to dive deeper into one of my functional medicine type programs. But omega-6 fatty acids are the inflammatory ones. Those are your unhealthy fats, your trans fats. That's the fats that are in potato chips and packaged foods and regular feedlot beef, pork, and chicken. Omega-6s are inflammatory, and omega-3s are anti-inflammatory, healthy fats for your body. Now, there are both animal and plant sources of omega-3 fatty acids. Animal sources are things like krill oil and fish oil. And plant sources are flax seeds, chia seeds, hemp seeds, those kinds of things. Now, the marine sources such as fish and krill oil provide a type of omega-3 called EPA and DHA, which are the most protective for your heart and for your cells. The plant sources like flax seeds and chia seeds, they contain a different type called ALA. Now, you're really better off choosing the animal-based variety, much better off choosing the animal-based. Most of the health benefits of omega-3s have been linked to the EPA and DHA animal-based forms, not the plant-based forms. Furthermore, ALA is converted to EPA and DHA in your body in a very low ratio, which means you would have to consume huge amounts of the plant-based one to get any benefit out of the EPA and DHA ones. So basically the bottom line is you need to take the marine variety, krill oil, fish oil. You need to take those instead of the plant-based ones. So what I mean by that is sometimes I have patients go, "Oh, doc, I don't need to take that fish oil. I put flax seeds in my smoothie." That's not good enough. You need way more than that. The animal sources, the marine sources, are very important. Now, I'm not saying that the plant-based sources are bad, because they're not. Ideally, what you would want to do is include a lot of the animal-based form in your diet, and then you can combine that by throwing a few chia seeds in your smoothies or a little bit of plant-based one. But don't think that you can just do the plant-based chia seeds or flax seeds and get enough of the required omega-3s for your body, because you can't. So, for example, I take EPA and DHEA forms of the fish oils. I take those in a capsule form. Plus, I include them in my diet. Plus, I try to throw some chia seeds or flax seeds in my smoothies. That's the best way to do it, so that you're giving your body a variety of these essential fatty acids that it needs. So I try to get some of both. But supplement-wise, it's almost impossible to get adequate omega-3s by just doing the plant-based. You have to include the marine-based ones in order for your body to really get what it needs. In 2008, the American Journal of Clinical Nutrition published 3 studies investigating the role of omega-3s in the elderly, and they found low concentrations of omega-3s increase the risks of death from all causes. From all causes. It doesn't matter what disease you name, omega-3s affected that disease in some way. It benefits your health in so many different ways. The Italians did a study where they followed 11,000 heart attack survivors, and they found that that were supplementing with fish oils had a markedly reduced risk of another heart attack or stroke or death. So you really, if you've had heart problems in the past, you really want to be mega dosing with some omega-3 fish oils or krill oils. It could cut your heart attack risk by half by eating just fish once a week or taking some fish oils. And by the way, guys, when I say eating fish once a week, I'm not talking about fried catfish. I'm talking about something like Alaskan.
Darn. Come on, Doc.
I know. I'm talking about something from far north, like Alaskan wild-caught salmon, a cold water fish, from as far north as you can get it. It's clean. It doesn't have the mercury and harmful contaminants, and it either baked or broiled. So, for example, baked Alaskan wild-caught salmon, for example, that is one of the most hard. I try to eat that once a week, and a lot of times patients will go, Doc, I don't like fish. I don't like baked fish. I take Alaskan wild-caught salmon, put it in a piece of foil with some lemon pepper and salt and pepper and put mustard on it. It takes all the fishy taste out of it. It's real. I don't really like fishy taste either. This is really good.
And what about for people that are maybe looking and saying, hey, how about some, baked fish, some baked tilapia? You see that everywhere you go in the store.
Yeah, and I've talked about tilapia on the show before. Tilapia is really one of the most toxic, low-value fish that you can really put in your body. You really want to go with something like an Alaskan salmon or Alaskan halibut. Something from the cold water up north is way better. These farm-raised tilapia that come from China and Vietnam, trust me, they are not good for your health. They have nothing that's beneficial that fish have in it. But, it's so much easier just to supplement. Omega-3s normalize and regulate your cholesterol and triglyceride levels. Now, get this. Compared to statin drugs, both fish oil and krill oil were more efficient in regulating your cholesterol and triglyceride levels than statin drugs. Study after study has shown that your triglyceride levels will go down and that your clotting factors will improve, preventing stroke and blood clot, and that this fish oil is anti-atherosclerotic, meaning your arteries won't clog if you just will supplement with this fish oil. And finally, DHA can affect your child's learning and behavior in dramatic ways. If you want to maximize your child's intellectual potential, DHA has been the most effective way of doing that. Omega-3s have a great impact on brain health. When my little boy when his mom was pregnant, we started out, as soon as we found out she was pregnant, we started mega dosing her with omega-3s. And then during breastfeeding, we upped it even more because we wanted the breast milk to have as many healthy omega-3 oils as possible into the system. And then as soon as he started breastfeeding, as soon as breastfeeding was over, we started liquid omega-3 supplements in his organic baby food. And that's really something that is so important for a baby's development. Now, these omega-6s that are inflammatory are something that you want to avoid, and omega-3s are the ones that you want to add. And by the way, whenever I say that, it really isn't that simple. You actually need both omega-3s and 6s, but the ratio should be 1-to-1, meaning you should eat 1 6 for every 3. And unfortunately, in America, that average is 20-to-1 all the way up to 50-to-1. And that spells danger to our health. That's what makes this so inflammatory. I'm not saying if you have no omega-6s in your diet, that's okay. But you don't have to worry about that. You're going to get the omega-6s. It's the omega-3s that you really have to add. It's one of the most pressing health issues plaguing the world today. Many scientists and doctors have stated just that omega-3 oils, omega-3 fatty acids are among the most serious and pressing health issues plaguing the entire world. And I would agree with that. I would think that's probably the thing. I said vitamin D as number one, but, honestly, omega 3s are one of those things where you could just hand those out to everybody and not worry about the dosages. And speaking of that, I personally take 3,000 milligrams of fish oil a day at night because you get a higher absorption. And everyone on the face of the planet should be taking some fish oils. And sometimes patients will say, well, isn't that too much? It's impossible really to take too many omega-3 fish oils. Let's think about this a second. This is fat that you're eating. It's just fat. It's like any other fat. So when you compare a steak, the steak that you went out to Outback and had may have had 30 grams of fat in it. Or a salmon steak may have 25 grams of fish oils in it. If you take 3,000 milligrams of fish oil, that sounds like so much. That's 3 grams of fat. That's 1/5 of a salmon steak that you're eating every day if you take 5,000 milligrams of fish oil a day. So don't get too caught up in this, oh, that might be too much. It's really not possible. I mean, that would be like saying you can eat too many fish and that's going to damage your body. This is just fish fat that you're eating. You can't really take too much. And sometimes I hear doctors say things like that. Well, that might be too much of that fish oil that you're taking. That can be dangerous. Meanwhile, Advil and Tylenol kills over 16,000 people a year. I mean, it's just, it's kind of funny. All this natural health care is risky. I think it's pretty obvious that's not true. It's effective. That's the real answer. It's effective. And when we get back from this next break, I'm going to tell you the third thing that you should be adding to your supplement list every single day. And if you're interested in talking to me personally about your individual health problems to see if my methods might be able to help you with whatever you're struggling with, you're welcome to call my office at 837-7174. Leave your name and number on the machine. I'll call you back when I get back to the office next week, and we can have a simple phone conversation to see if I think you might be in the right place. That number's 837-7174. Don't go away. We'll be right back after this short break. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining us on the show today. We're discussing the top supplements that most people should be adding to their diet. And I did want to say before we move on, though, that my functional medicine program is not just about taking supplements by any means. There is so much more to figuring out what's causing your health problem than that. You can't just throw some supplements at the body and expect it to get better. It's so much more detailed than that. And I didn't want you to get confused that, oh, I'm just about taking supplements, because it's definitely not. But we talked about D and how important that was. And we talked about omega-3 fish oils and how important they are, and that everyone on the face of the planet should be taking some omega-3 fish oils. And honestly, if I could pick two things, I'd call it good right there. You really don't need to dive much deeper than that. You could take those two things and call it good. But this next one makes the list because I feel that many people are low in this and probably should add some of this to your diet as well, and that is magnesium. Magnesium is a mineral that is crucial to so many bodily functions, and we see low magnesium in way over 50 or 60% of the patients that we test. Magnesium helps keep your blood pressure normal. It helps keep your bones strong. It deals with heart arrhythmias and keeps the heart rhythm steady. Many people in the United States aren't eating enough foods that contain magnesium. Adults who consume less than the recommended amount of magnesium are more likely to have elevated inflammation markers. So we're back to inflammation again, guys. It's like everything boils down to inflammation. And doctors all the time will say inflammation is the precursor to chronic disease. And that's easy enough to say. But are we getting as far upstream in the body as possible to find out where this inflammation is coming from? That's where the real work starts. That's where natural functional medicine healthcare should begin. Let's get as far upstream in the body to see what is in this body causing this inflammatory process. But as far as magnesium goes, several studies show that eating foods high in magnesium can help prevent high blood pressure. And like I said, heart arrhythmias and cardiovascular problems. Magnesium is very connected to heart health. Now, magnesium is also important for a proper functioning digestive system. Many times patients that have a sluggish digestive system, we can give them magnesium and it will make a big difference. But a lot of people that have bad digestive systems and they take these proton pump inhibitors like Nexium and Prilosec and Prevacid, these medicines negatively affect your magnesium levels. So again, we end up with this downward spiral. You have a bad digestion and you need magnesium. So you take these medicines, which in turn affects your magnesium, which makes your digestive system worse. And now you're in this downward spiral of sickness and disease. So in order for us to get your magnesium right, we have to heal the gut. We're back to gut health again. Magnesium and gut health are very closely connected. And in our digestive health program, it's designed to do exactly that. You have to heal the gut lining, get the digestive system working properly, deal with things like the leaky gut and low stomach acid. And yes, low stomach acid is a thing. I've mentioned that before on the show. I've had whole shows on the low stomach acid. But if you don't do those things, you're never going to get the magnesium levels where they need to be. So it's more than just taking magnesium. You really got to get upstream and see what else is going on in the body to get the patient to absorb what you're giving them. So this is a lot more complicated than just handing out supplements and calling it a day. That's a very lazy way of doing natural health care, and that's absolutely not what I'm all about. But I think it's safe to say that most adults should be taking 300 or 400 milligrams of magnesium a day. However, leafy green vegetables contain a lot of magnesium, and so do nuts. So if you're eating adequate leafy green vegetables, which I know all of you out there are doing, then you might be getting plenty of magnesium. No, you probably are going to have to supplement because most people aren't doing that. But magnesium supplements are not safe for patients who take diuretics, heart medicines, or antibiotics. So if you're on those things, you need to speak with your healthcare provider first. Many people with diabetes, intestinal diseases, heart diseases, and kidney diseases should also not take magnesium before speaking with a healthcare provider. So I'm certainly not saying that if you have any of those things that your magnesium is okay, but you certainly need to discuss with a healthcare provider and do that a certain way. But I felt this was important to mention today because it's such a critical mineral to your body, and so many people are low that we check. And in my program, we test this. We test the level of magnesium before we decide any dosages. We have to know what your levels are so that we can decide how much your body needs in order for you to regain your health. And also, absorbing it is a big deal. Like I've been saying, it's not what you take, it's what you absorb that matters. So many patients we check, their digestive systems are so destroyed that anything they take, they're not absorbing. And that's why I like powders and liquids. Most of the supplements that I talk about are powders and liquids so that they're very readily absorbed. I talked about my vitamin D. That's a liquid so that it goes straight into the body and it doesn't have to try to get through the destroyed digestive systems of so many patients that walk into our office. It's not what you swallow, it's what goes inside your body that matters. And when we get back from this break, I'm going to tell you one more thing that you may consider adding to your diet. But if you have health problems that you want to talk to me about, you're welcome to call my office at 837-7174. Just leave your name on the machine and say, I'd like Dr. Kevin to give me a call back when he gets back to work next week. And we can have a little phone conversation to see if I think my methods might be right for you. 837-7174. Don't go away. We'll be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on this show today, this very important show. We're discussing daily supplements and what are the most important things that you probably should be taking and adding to your daily regimen. And guys, listen, I'm not one to tell a patient that they need to take 5 or 6 or 10 different things to make their body work again. It doesn't work that way. My functional medicine program is designed to figure out why your cells are malfunctioning. Why are these cells doing what they're doing, and how can restore those cells to function better? And a lot of these so-called natural healthcare programs are basically just treating symptoms with supplements. And that is not what I do. So instead of medicine, they ask you what your symptoms are and give you supplements to try to cover up those symptoms. That is not the pathway for you restoring your health. You have to figure out why the body is doing what it's doing and then say, what can we do to get this body to work better in this area? It's supposed to be about getting as far upstream as you possibly can in the cause of disease and figuring out what we can do to try to make the cells work better. But yes, it's true that most people could benefit greatly by taking some vitamin D. Everyone could benefit by taking some omega-3 fish oils and probably some magnesium. Now, there's one more thing that I would throw in the mix, and this is kind of a tough one to explain, but if I could pick one thing to give everybody in America other than what we talked about, it would be a green drink. What do I mean by green drink? And there's several of them out there, and what I mean is it's basically ground up leafy green vegetables. So it's an organic powdered green drink that you take a scoop out like you would a protein shake, and you put it in water and stir it up, and the water is then green, and you drink that down. It's all of the little phytonutrients that you get from leafy green vegetables. It's all of the enzymes and all of the benefits of leafy green vegetables in a drink. It's a powdered form. You can mix it up in a glass of water and drink it down every single day. If everyone would do that, they would be so much healthier. It's because taking supplements, you're never going to get the same thing as you are in the actual plant itself. It doesn't matter how good the supplement is. It's not the same as actually eating the food, eating the leafy green vegetables. And the easiest way to do that, since nobody eats enough leafy green vegetables, is put a scoop of powder in water, stir that up, and drink it down once a day. It's such a health benefit. It decreases inflammation and cancer and heart disease and almost every disease that you could name. And an honorable mention, I know I said 4, but this is just something else that I wanted to mention, would be trace minerals. Trace minerals is a liquid that comes with a little dropper, and it contains all of the little minerals that your body needs to function properly. All of the little zinc and potassium and manganese and iodine and selenium. It's essential trace minerals. Our food contains almost no mineral content anymore. One apple in 1958, you would have to eat 20 apples to equal the same mineral content today as one apple did in 1958. So an apple a day did keep the doctor away, but it's not quite that easy anymore. Vegetables and green vegetables just aren't the same as they were 50 years ago. Modern farming methods are to blame for this. It's the decline of the copper and zinc and potassium and other minerals in our food due to soil depletion. Using artificial fertilizers can make a nice looking plant, but it doesn't contain a lot of these essential minerals that our body needs. and that it was developed to run off of. So many people could benefit by taking some trace minerals. Now, in my program, we don't just throw supplements at people. It's all about knowing. We test all of the essential vitamin and minerals of the body, and we replace the ones that you're lacking back to its peak performance. And my version of functional medicine is about trying to figure out what is going on in the body so that the body can't heal. And we talk about that every single week here on the show. Just taking a few vitamins isn't probably going to restore your body functions, but if you have no health problems at all and you were wondering what you should be adding to your daily regimen, hopefully these things will have given you some things to think about. Taking supplements is important, but to restore your health, many times it takes a lot more than that. And if you want to talk to me about your particular health condition to see if I think my methods might be right for you, I'd like to invite you to call my office at 837-7174 and leave your name and number on the machine. My purpose is to try to help as many people as possible out there that are suffering. And it's such a tragedy to me when people are suffering and natural solutions exist. It's just nobody's told them about them. And that's what I'm here to do every single week. So thank you so much for tuning in. That number again was 837-7174. Thank you all for listening. Have a great weekend.